Hey everybody, this is Dr.Quinn at Ozark Holistic Center. I wanted to shoot this video because it's kind of a unique presentation that showed up. So we're got Amber on the table. She's having issues when she's like bending down to like touch the ground, touch her feet with her hands, kind of thing. So just she can feel it like really tense, tight as she's like curling over. She does get some pain with it, but she just has to go real slow before she's able to get there and then come back up. She's starting to feel that same tension level, even with walking, and just like right across the base of the low back area. And that's actually I wanted to shoot this one because it's a pretty common complaint. I'll hear from people. A lot of times this is how pains and stuff will even start, and so if it's not addressed, then it does get worse, where it's also like, oh, now I'm dealing with nerve pain or sciatic pain, or also my back went out. And usually this is kind of one of those earlier symptoms that people will experience. Is that tension right across the base of the low back area, sacrum, where those two come together. And so what we'll do, if you've seen some of our earlier videos, is go through some of the muscle checks. In her case, I've already tested those, push up with those quads. Quads check good, hamstrings, gastrocs all test good. Even her QLs, which is a common push to the left, is often involved in this, push to the right. In her case, it is strictly her psoas muscles, push straight up, and they are weak on both sides. So psoas is one of the major hip flexors. It does attach to the upper femur and then goes in all the way up and attaches to the anterior aspect of the vertebrae of your upper lumbar vertebrae here. And so it does cut right through that abdominal area. This is a really common muscle to be an issue with any kind of back problem, and when it gets tight, it will actually compress the spine down, and that's what actually creates that tension across the low back area right there where she's experiencing it. Is it just creates this here and things get stiff. So as part of this, which is what I want to show that we'll end up having to do, which is what we're going to do here first, an actual psoas release. So that psoas muscle is usually not the most comfortable thing in the world, as you're kind of digging in pretty deep into that area. We'll often have to check all the different components of it, which we should actually do right now. Sometimes it's closer to the actual attachment points, push up. We're just looking for what area of release, push up, is going to create activation in that psoas. If it's more closer to there it is. So it's actually higher. It's going to be digging in. And it is true, especially as you're getting further into abdomen, you're really not being able to get a full a real contact on that psoas. Closer here to the hip, you can't actually get to its attachment point as you go further in. So you have to be really careful with the type of pressure you're putting on. It is kind of a slow pressure, and you're kind of trying to get deeper and deeper as you do have things between you and that psoas for sure. But that pressure alone does work to get this thing to actually release. Cool. Release that out. And you will often feel it under where we're pushing, push up. So weeks, and we're going to check the lower one because that checked as well. Again, you're just checking along the lines of where that muscle runs. This is a little bit more sensitive. Yeah. And so there's a couple of reasons why, again, this will happen. Part of this is part of the guarding reflex. If there is any kind of injury or overstrain or sprain in the low back, certain muscles will tighten down in order to restrict movement, in order to try to prevent further injury. And so we actually will be looking at the low back as well, making sure that it's actually properly aligned and released, as we are actually releasing the psoas, which is part of the, again, kind of guarding reflex. This will also happen, you'll see this a lot with people that sit all the time, especially in our modern day where people are having to sit like at work all day long. The way muscles actually work is they're trying to identify a certain position that they want to be in, or a certain length. Sorry, length is the right word. A certain length that they want to be. If you consistently keep them in a shortened position, which is what happens in a seated position, that psoas actually shrinks. If you leave it there long enough and consistently enough, that psoas muscle will actually shorten its length. It is able to actually alter, again, the length of the actual muscle fibers, and so it will actually shorten the length of those muscle fibers. It's not like a rubber band concept where they're just like pulling in. They will actually start to decrease the size of that muscle. So this is actually why it's common that we'll see this. So part of the things that we're actually getting on is attachment points, because with that activation of the attachment points, you're able to get it to lengthen further, and you're able to work on opening it up in order to keep it and get it to start going the other direction. So just like you can get it to shorten, you can get it to lengthen. Sometimes it just takes a little bit of time. But usually we get it to release, then you kind of release that tension in it. It works to start moving back to the position that it needs to be in. Push up. Fantastic. Same thing, other side. Still got there. Is that lower? Other side. Yeah. Okay. And do that release here, and then we're going to check that. I'm hoping that's going to do the trick, and that's. Now, muscle is a really interesting thing. It is definitely a component of the pain pattern and pain response. A lot of times what the pains people even are experiencing is the referral pains from muscle tendons and muscle attachment points. I see that all the time. There it went. You actually probably felt, I don't know if you felt that, but there was an actual kind of audible release in that Psoas. Push up. There we go. We're going to check that point on the back. Push up. Because usually there is a need for an actual release in the back as well. I'm just going to do that real quick and have you actually turn over for me, go face down. It actually comes up and attaches to, again, the anterior aspect of that upper lumbar vertebrae, the L1, L2, L3 area. So that's actually what we're going to be looking at. Is there. Perfect. Turn back over for me. Recheck that. If we're good, we're good. Yep, so from there she should be able to actually kind of bend down, feel that it isn't catching anymore, and anything like that, and get down, touch, come back up. Again, great thing to do in terms of prevention from this turning into a bigger issue.